Are you just going to be like all those other researchers and do nothing? How is this project different? She asked. When she said that, I laughed nervously and really felt the importance and the weight of this project's potential. As a physician, I had preconceived notions that the women would talk about their HIV medications and side effects. But they kept bringing up stigma, discrimination, over and over again. I hadn't even thought about that. We don't get taught about stigma in medical school. They talked about isolation, housing issues, depression, and the trauma they had experienced. The women's voices changed me as a doctor forever. Before, when I saw a patient, I would ask about the HIV medications and wave my finger about how important adherence was. Now I start by asking, "How are you doing?" I ask about depression, housing, finances. I ask about their children, their immigration process, and their stigma. I ask, "How can I help you?" I try to do everything they need in one visit. I do their pap smears, I fill in all their paperwork. They can bring their children, they can bring their partners. I think more health care should be coordinated to meet all the women's needs in one visit. The women's voices also changed me as a person. I talk about HIV and equity all the time. About how people with HIV can take medications and survive 60 years from diagnosis, and how they can have healthy babies. One of the most rewarding stories was when my dad and stepmom told me that one day a delivery man came to their house to deliver a bed and saw a magazine picture of me on the wall. They started bragging about how I work with HIV-positive people to help them, and I help them get pregnant safely, and how it was so great. Halfway through the visit, the man turned to them and said, "I'm HIV positive." He had never told any strangers that before. I was so proud that my family could create a safe space for that man to open up to them free of judgment. The potential I see is a world free of all judgment, where everyone could be fully open. This is what our research is working towards.